This video provides a concise overview of common medications encountered in the intensive care unit (ICU) setting, focusing on their mechanisms of action, uses, and crucial considerations for safe administration by nurses. The cardiovascular system, maintaining blood flow and heart rhythm. Vasopressors and inotropes. These medications work on the circulatory system to address two critical needs. Vasopressors, e.g. norepinephrine, increase blood pressure by constricting blood vessels, ensuring adequate perfusion to vital organs. This is analogous to narrowing lanes on a highway to increase traffic flow in a specific direction. Inotropes, e.g. dopamine, enhance the force of heart contractions, improving blood flow throughout the body. Imagine them as boosters for the heart's engine. Conditions treated. Vasopressors and inotropes are used in various situations where the circulatory system is compromised, such as shock states, sepsis, cardiogenic shock, anaphylaxis, and heart failure when the heart is too weak to pump blood effectively. Precautions. Close monitoring of heart rhythm, arrhythmias possible, blood pressure, risk of excessive constriction, and urine output, potential for kidney injury, is essential. Additionally, the medications need to be titrated to achieve the desired effect without compromising blood flow to vital organs. Nurses should also be aware of potential interactions with other medications. Maintaining a normal heart rhythm. Antiarrhythmics. These medications target various mechanisms in the heart's electrical conduction system to restore or maintain a normal heart rhythm. They act like tiny electricians, regulating the heart's electrical impulses. Conditions treated. Antiarrhythmics are used to treat cardiac arrhythmias such as atrial fibrillation, ventricular tachycardia, and ventricular fibrillation, irregular heartbeats. They can also help prevent recurrence of these arrhythmias. Common examples: amiodarone, cortisone, a broad-spectrum medication for various arrhythmias but has a complex side effect profile. Lidocaine, a fast-acting medication for ventricular arrhythmias, particularly effective for suppressing premature heartbeats. Metoprolol, Lipressor, a beta blocker used for rate control in atrial fibrillation by slowing down the heart rate. Precautions. Continuous monitoring of heart rhythm is necessary to assess the medication's effectiveness and identify potential side effects like new arrhythmias. Electrolyte imbalances, potassium, magnesium, can worsen arrhythmias, so they must also be monitored. Nurses should be aware of potential interactions with other medications, especially those affecting heart rate or blood pressure. Promoting relaxation, pain relief, and mechanical ventilation support. Sedatives and analgesics. These medications play a crucial role in critically ill patients by promoting sedation, calms anxious, restless, or confused patients, e.g. propofol, diprivan. Pain management provides pain relief during procedures or for ongoing pain, e.g. fentanyl, morphine. Facilitation of mechanical ventilation allows for smoother ventilator support by promoting relaxation and reducing the work of breathing, e.g. propofol. Conditions treated: agitation, pain management, and facilitation of mechanical ventilation. Precautions. Continuous monitoring of respiratory rate is critical to detect potential respiratory depression, a life-threatening complication of these medications. Titration is essential to achieve the desired level of sedation or pain relief while maintaining adequate respiratory function. Opioids require cautious use in patients with respiratory compromise or a history of sleep apnea due to the risk of respiratory depression. Nurses should be aware of the potential for dependence and addiction with long-term opioid use. Preventing and treating seizures. Anticonvulsants. These medications work by stabilizing abnormal electrical activity in the brain to prevent or treat seizures. They act like stabilizers for the brain's electrical circuits. Conditions treated: stopping ongoing seizures, status epilepticus. Medications like lorazepam, Ativan can rapidly stop ongoing seizures. Preventing future seizures, used in patients at high risk of seizures, such as those with a history of epilepsy or head trauma, e.g. levetiracetam, Keppra. Common examples: levetiracetam, Keppra, a broad-spectrum anticonvulsant for various seizure types with a favorable side effect profile. Lorazepam, Ativan, a benzodiazepine used for status epilepticus and short-term seizure prophylaxis. Phenytoin, Dilantin, a long-acting anticonvulsant for seizure control, requiring close monitoring of blood levels to ensure effectiveness without toxicity.